Or you can put it over there. Or you can put it over there.
We're hanging out. We're hanging out at Dr. Swerdlin's today. Leah's excited.
I am excited.
Why, Leah? What are we doing today?
We are doing an allergy test. I need an update.
Okay.
So-
All right. You had an allergy test before.
Yes,
But
here.
But she wants to get another one just because. You
They
think
change.
they change?
Your allergies
How
change.
how often should you get an allergy test, Dr. Swerdlin?
Hi,
good to
how
see
are you? Good to see you.
Good.
So it depends. Your allergies may change in 10 years or 15 years. Or you might develop new allergies, or maybe you move to another state and they have other allergens. And the allergy test is super
Simple.
easy.
It's not like it used to be. When I was a kid, man, it was the
poked
worst
you.
thing ever. It was on
There
my
was, like,
back, and it was a
needles
nightmare.
and-
Yeah.
Yeah, we don't
Not
use
a thing.
needles. I call it the allergy brush test. It almost looks like a brush.
Okay.
Like the little plastic brush that we used when we were kids to brush our hair.
All right.
So it's like a little brush. It doesn't hurt at all. This is Angie. She's my nurse practitioner.
Hi, Angie.
And we have Drew over there, who's my other physician associate.
There you
So
go.
I'm very fortunate to have them be part of the team.
It's a good team.
It's a great
Yeah,
team. You
yeah.
met Mario last time, who's also part of the team. And we have Kasha in Mount
Jeez.
Prospect and Lombard.
You must get to golf a lot.
I have a tea time in about 30 minutes.
Okay. All right.
So
All right.
I
All
need
right.
to
All
keep
right. All
going.
right. All right.
No, I'm kidding.
He's so good he golfs in the rain. All
That's
right.
right. I need to work. I need to golf all the time just so I can learn how to do it.
All right.
So the allergy test, we're testing for 48 different things, and if you zoom in, each one of these is a different panel, and it has 8 little different wells. So A is kind of the animals and indoor stuff. So we have dogs, cats, dust mites. B and C are the tree pollens. We see the tree pollens in the spring, and then D is a mixture of weed pollens like ragweed. E has some grass pollens and mold, and F is mold. We don't really do foods. We used to do foods, but we don't do food anymore.
So this is more like airborne things or things that you
Yeah,
find in
things
the
that you
house or
breathe.
what. Now, what percentage of people that are suffering from stuff? It's mostly things like that. It's not food or.
It's about 15 to 20% of the population has allergies.
So
A lot of
much,
people have
yeah.
allergies. And it's very, very hereditary. So if your father or your mother have allergies, you have a very 50% chance of having allergies. Also, allergies have been associated with asthma. The majority of young adults and children that have asthma is because of allergies. So if you identify what they're allergic to and you treat the allergies with immunotherapy or desensitization, the chances of them developing asthma, particularly kids, is very significantly reduced. So if you have a child that has asthma and you get them allergy tested, you might be able to make the asthma better or prevent asthma from developing. And also you may prevent them from developing allergies to other things. So we see little kids, we don't see that many kids anymore, but when we used to see kids, they would have only one allergy to one thing. And we treated that allergy and then they wouldn't develop allergies.
So if you treat one allergy, you might not have to deal with other ones. I did not
Yes.
know that was a thing. It's
That's
like
with children. And you may prevent them from developing asthma.
Okay.
And there's been studies about that.
Well,
But this-
I brought in my little girl Leah.
Hey, Pop.
Yeah, there we go. And
ready.
she needs to get tested. So explain kind of what we're
So
doing
we'll
here.
Get started. It's actually plastic, so they're not like, needles that hurt. They're just
All
little
right.
plastic pricks. And what we do, we'll start here and we'll kind of, without hurting the patient, just kind of
Nothing.
You
move
okay?
around a little
Nothing.
bit.
All right.
Make sure the
I'm a baby.
liquid is there.
Okay.
And then same thing for the next category, and then we'll label them so we know.
Now, how many of those do you do then? How many
48.
sets do you? So you do
so it's 6 brushes.
six brushes.
Yeah.
6 times 6 is 48. Look at me. All right. Now, why are we getting tested for these things? I could just go to the store and grab something over the counter and treat that,
A
or
lot of the over-the-counter medications have side effects. Some of the over-the-counter nasal sprays, like that contain Afrin, they have side effects of high blood pressure and tachycardia, which means rapid heartbeat. But you can also get addicted to those sprays. Some of the medications like Claritin D or Sudafed do the same thing. They can give you high blood pressure and rapid heart rate. Some of the antihistamines like Benadryl or Nyquil can make you tired. So it's better to know what you're allergic to, especially because you can do immunotherapy. You can figure out exactly what you're allergic to and treat with with allergy drops. That's what we use. You put the allergy drops underneath the tongue, and we usually custom make the allergy drops to whatever you're allergic to. So if you're allergic to cats and tree pollens and mold, we custom make them, and they're FDA approved antigens. And then you put them under your tongue once a day, and that desensitizes you, so your allergies get significantly.
So do you
better
have to
or
do the
lower.
drops forever, or you just do them for a while?
3
and
to 5 years,
Yeah.
and they last for 10 to 15 years. Then you might need to do them again, but they help with asthma, they help with sinusitis, and the fact that you don't have to go to the doctor and get an injection once a week, and that injection usually causes a bit of swelling of the arm. And it's time consuming, and you have to wait in the office for 30 minutes. The allergy drops you can do.
Well,
in
you
your house.
lost me on that one with injection. So the drops I prefer because
Yes.
there's no injection, and I don't have to go to the doctor's office.
No,
you give
you
me
do
the
them at home.
drops,
You do them
and
at
I do them at home. Okay, and I do them for what you said, 3 to 5 years,
3
but
to
then it can
5
work
years.
10 to 15, and you don't have to worry about allergies.
Yeah, they may work about 10 to 15 years. Sometimes they work much longer. And it's a very simple thing to do.
Yeah. Now, how long do we wait after she gets the?
She's already starting to. You can see that there's starting to be a little bit of red. So you wait about 15 to 20 minutes. 15 to 20 minutes, and then we'll basically read the allergy test, and based on that, we can come up with a plan.
Okay.
I've been doing allergy drops for a long time, and now they have become very, very much accepted.
Yeah.
And so a lot of allergists are using them now, and they have been studied much more. They've been studying in Europe, now they've been studied in the United States. So it's been much more standardized and much more uniform.
And you said 10 to 15% of people probably suffer from something that
Maybe more.
that what you're testing here.
maybe more.
Yeah. And now, what amount of what you do here? SinusandSnoringMD.com is the website to
Yes.
check out. What percentage of your work is allergies, or most of what you deal with is snoring, right?
We deal with snoring and nasal problems like runny nose or stuffy nose. If somebody has a stuffy nose, if somebody has a lot of sinus infections can go into the ear, so you can get ear infections. So it's surprising how many people that have ear infections or ear problems or hearing problems have sinus problems. People that have problems when they go in an airplane or when the weather changes and they have ear pain or sinus pressure, we can treat that. Many times it's allergies, many times it's blockage of the sinuses or the ears, and we're able to treat and diagnose that very easily.
And if it gets extreme, you deal with sleep apnea and things
Yes,
like
we
that.
do home sleep tests. So people that snore, some of them might have obstructive sleep apnea, so we're able to send them home with a home sleep test. And then if they have sleep apnea, basically if they stop breathing more than 5 times per hour, we have all the available treatments. That it could be the nose, it could be the throat. It could be many different.
Now, a lot of people look for that, but they look at the CPAP machine, or what's the difference between that and coming here and what you do for people?
So, in order to figure out why somebody has obstructive sleep apnea, we do an exam. We evaluate the upper airway. We look at the nose, and we have tiny little spaghetti cameras that get inside of the nose without you even noticing that they're there. So it's very painless. We have video cameras, so we're able to video document our findings. We can see the whole upper airway with tiny little cameras. If there's any obstruction, such as polyps or sinusitis or large turbinates or allergies, we're able to identify that and take care of that. We also do CAT scanning in our office with minimal radiation, and that CAT scan actually turns into a GPS system. So we need to correct the sinuses with a little balloon, like balloon sinus dilation. We're able to use navigation, a GPS system to perform that, and we can do that in the office with very minimal discomfort.
So you actually fix what is causing the sleep apnea, as
Exactly.
opposed to just forcing air through it.
Exactly.
With
If
the
they have large
CPAP
tonsils, sometimes we can make the tonsils a little bit smaller. There's methods now that we can shrink the tonsils. So if the uvula is very large, we can remove the uvula. There's many things that can be done. We can also fit them with an oral appliance, which is like braces that you wear at night that prevent the tongue from falling back. And of course, CPAP. Some people will actually need CPAP. We also, talk about weight loss. Some people are overweight. And so we talk about all of those factors in the office, but we need to diagnose the reason why somebody has obstructive sleep apnea and then treat it.
Did you say remove the uvula? Did you
Yeah.
what does it do other than open your mouth, other than looking like a punching bag in the back of the throat, other than being it looks like a little punching bag? What does it do? Does the uvula do
As you
anything?
get older, it really has no function. maybe when you were a fetus or when you were born at the beginning, it probably had a function. But as you get older, you don't really need it.
I remember being glad I had one when I was a fetus. I was like, I was like, man, I got a nice uvula. So, but now people don't look at it anymore.
Some people, you just look at Leah's uvula.
But so you can remove it or shrink it down?
We make it smaller, or we suture it. Sometimes the soft palate we can stiffen it with stitches or different things, because snoring is caused by vibration of the soft tissue. And we have procedures to stiffen the soft palate.
So if you have a really good melodic snore, maybe it's your uvula that's doing it.
Could be the uvula. It could be the
It's
tongue.
like a reed on a woodwind instrument or something like that.
That's right. It's not that frequent that we need to remove.
All right.
But we have those tools available.
It's interesting the things we learn when we visit Dr. Swerdlin. Now Leah got the allergy test, and there's some little red splotches.
She's definitely getting. This is cat over here.
So you know what they are. Just
I memorize them already.
Yeah.
We do them but you can see the
She
guy.
has
The guy
a
is
cat.
there.
She has 3.
She has 3 cats.
cats.
This might be your problem. Where's cat, Dr. Swerdlin?
A4. So this is
A4, bad kitty. All
So
right,
there's
all right.
cats. And we've had patients that are allergic to work.
Really?
Yeah.
Yeah. I think I have
Which one
that.
is that? Is that A1?
Leah's got that too.
I think that might be the top
Is there
one.
anybody who doesn't have the allergic to work one going? So
So let me ask you, who do you think will have an allergy? What profession is the profession that would?
the most allergies?
That-
Well, not garbage men or ditch diggers because they're around
Doctors.
like poop and all that. No, they're around it all the time too. I don't. Not school teachers because they're around it all. I don't know, man.
So people that work outside,
Yeah.
also veterinarians. So if you're a veterinarian, you would be allergic to work because you're allergic to cats.
All right.
But we've been able to treat them.
You can fix that. You can
we've
treat
been able
that.
to treat veterinarians with allergy drops, and they do well.
Yeah.
I love my cat.
We're allergic to BS in our line of work because we're around it all the time. So that's what that is. All right, so we're gonna figure out exactly what's causing Leah any problems, and then the drops, and then
Yes.
it should get better for her.
Yes.
All right. Sinus and snoring problems, nasal problems, anything else that we're missing, Dr. Swerdlin? SinusandSnoringMD.com is where you can find everything. But that's about the majority of it, right?
Is the majority, and we'll be more than happy to see you. You know, the original name of our clinic used to be Ear, Nose, and Throat Family Clinic. It's still our legal name, and the reason that we have that name is because we treat everybody like family. That's our mission statement. So that's,
Dr. Swerdlin will give you his cell phone number.
Yes.
And I didn't believe you, and I tested you, and it was your actual cell phone number. So
Yes.
you care about your patients, which is nice. Yet you're not an impersonal guy, and you're good to have a conversation with them.
We're also very lucky, and we want to be thankful to all our patients because we've been voted, I think, 4 years in a row as best of Kenosha County.
Oh, there you go.
So we got it again. So that's thanks to the patients. Yes,
Yeah,
that
located
have
in here in Kenosha, also Oak Creek in Wisconsin, also Lombard and Mount Prospect,
Prospect,
in
yes.
Illinois. So nearby, and we've talked to you about that. You do it so that the patients don't have to travel far. You go to the different locations.
Yes, and they can schedule themselves with ZocDoc nowadays. You go online through ZocDoc and you can schedule yourself, and we have plenty of openings.
Okay, all right. SinusandSnoringMD.com is the main site, and that's where you meet Dr. Swerdlin and his team.
Are you eating?
I'm itching.
Are you a little bit? Yeah.
Which one do you think that
What is
was?
that?
That's a big one.
weed. That's one of the weeds.
Oh, yeah.
What kind of weed?
No, don't worry. Don't worry. Do you test for marijuana allergies? In Illinois, that would be a thing. It's legal.
Oh, I'm sorry.
She panicked
We'll never
there.
do that.
And we're in Wisconsin now, so we won't. So that's
Medical.
just.
I have a medical card.
All right.
So what I'll do is we'll wait a little bit longer. This is the key of the allergy test.
This is the chart. You don't need that,
chart,
Dr. Swerdlin.
and we
doesn't
will.
need
I
that.
kind of memorized that.
Yeah,
I didn't know
yeah.
exactly which weed was that one.
Which weed is it? Which weed is it?
It's called mugwort.
Mugwort.
It's
Mugwort. That was my house in Hogwarts. I was a mugwort.
Mugwort.
Yeah. We won the
then-
Quidditch title
Yeah,
one
the
year.
bottom.
And then you have a little mold called alternaria. This one I know. F4 is alternaria. And then here we have the grasses. So a little bit of mold, definitely.
So grass and weed
a
you're
little bit
allergic to. Sorry, Leah. And cat. When you have how many cats?
3.
Brilliant. All right.
I like to torture.
Doctor, it hurts when I do this. Well, then don't do that. So, but even though she lives with cats, you can get her the drops and
I don't have to get rid of my cats.
yeah.
No, but I mean, it might be nice if they don't sleep in your. You need to have like a room in your house, which is a sanctuary.
Stop
There's
putting
no
them on your
cats.
face. Get a cat-free room.
Yeah, you need a
I have
cat-free
to talk to the older one
And,
about
and
it.
you need to kind of take care of that So that bedroom has to get the cat hair is going to be there. So you have to really do a deep cleaning and maybe get rid of carpets and stuff like that.
And then after a while with the drops, it won't be an issue. Yeah.
Where's the husband on here?
It's the one that's super inflamed.
Get rid of him.
It always goes back to that. Anyway, well, thank you, Dr. Swerdlin, and your team.
Thank you.
We're going to
Great
get
seeing
Leah
you.
fixed up for the cat problem, the cat lady in training. And if you want to know more, sinusandsnoringmd.com. It's sinusandsnoringmd.com. And come and get your allergy test. Get your nasal problems, sinus problems, snoring, sleep apnea, all of that stuff. Sinusandsnoringmd.com. Thank you guys for today.
Thank you so much.
All
Great
right.
seeing you.
All right. Good luck with the cats and the other problems.
So many.